Alcohol consumption has been linked to an increased risk of several types of cancer, including cancers of the mouth, throat, esophagus, liver, colon, rectum, and breast. The level of risk depends on the amount and frequency of alcohol consumption, with even small amounts being associated with some risk. Experts emphasize that there's no safe level of alcohol when it comes to cancer risk, but they do provide guidance on limiting consumption. Key points from experts on alcohol and cancer risk. If you are hooked to alcohol, just know that there's no safe threshold for alcohol and cancer. World Health Organization, WHO, and International Agency for Research on Cancer, IARC, state that any alcohol consumption increases the risk of cancer. Alcohol is classified as a Group 1 carcinogen, the same category as tobacco and asbestos. Even low levels of drinking, as little as 1 drink per day, have been associated with an increased risk of certain cancers, especially breast cancer in women. If you as a person who indulges in much alcohol as a dose-dependent carcinogen, the more alcohol consumed, the greater the risk. Heavy drinkers, 3 or more drinks a day, face significantly higher cancer risks compared to light or moderate drinkers. For example, studies have shown that people who consume more than 7 drinks per week are at increased risk of cancers like esophageal, liver, and colon cancer. Moderate drinking is defined as up to 1 drink per day for women and up to 2 drinks per day for men by guidelines like those from the U.S. Centers for Disease Control and Prevention, CDC, and American Cancer Society, ACS. Alcoholic beverages has more interaction with other risk factors. Tobacco use. Drinking alcohol in combination with smoking multiplies cancer risk, especially for cancers of the mouth, throat, and esophagus. Genetics. Some individuals, due to genetic factors, may metabolize alcohol differently, increasing their cancer risk even with lower alcohol intake. There are greater chances of breast cancer risk and alcohol. There's a well-established link between alcohol consumption and breast cancer in women. Research shows that even low levels of alcohol, like 1 drink per day, can increase breast cancer risk by around 7–10%. The American Cancer Society recommends limiting alcohol to less than 1 drink per day for women due to the risk. While the risk is generally tied to ethanol, the alcohol itself, all types of alcoholic beverages, beer, wine, spirits, carry similar cancer risks. It's the amount of alcohol that matters more than the type of drink. What if a person cuts back on alcohol? Reducing or eliminating alcohol can lower cancer risk. If quitting entirely is difficult, experts suggest limiting alcohol to minimal levels. Dry months or mindful drinking trends encourage taking breaks from alcohol or moderating intake, which can help reduce long-term risks. Is the protective benefits of indulging in alcoholic beverages often overstated? In the past, some studies suggested potential cardiovascular benefits from moderate drinking, especially wine. But more recent research indicates these benefits may be outweighed by cancer risks, particularly for individuals with certain predispositions. Before we go on this subject, how much alcohol is too much? No alcohol is the safest option when considering cancer risk. If you choose to drink, guidelines recommend: women, no more than 1 drink per day. Men, no more than 2 drinks per day. Even moderate consumption should be balanced with awareness of increased cancer risks. Reducing alcohol or quitting altogether can significantly decrease your risk of developing cancer over time.